I'll discuss several key points related to managing high blood pressure. Now, recent research suggests target blood pressure numbers may not need to be as low as the previously recommended 120/80. I'll provide strategies for lowering blood pressure, including some natural remedies. I'll also highlight the potential side effects of common blood pressure medications and emphasize the importance of magnesium supplementation. Also, I'll list drugs that can actually increase risks and mention some excellent fatty foods. Finally, I'll go into more detail about nitric oxide and specific gene variants associated with increased risk of heart attacks and strokes. I'll also recommend a lifetime consumption of certain supplements for individuals with these genetic factors, as this information could be a game changer for many people. So if this topic interests you, I encourage you to continue watching as I'll be covering important and potentially life-changing information. High blood pressure or hypertension is a silent killer that affects millions of people, putting them at risk of heart attacks and stroke. It's a condition that often goes unnoticed, slowly damaging the body without obvious symptoms. And if you're dealing with this condition, you might be wondering just how low your blood pressure needs to be. See, recent research suggests the target numbers may not need to be as low as once thought. This could mean taking lower doses of medications or even managing your blood pressure without pills. Until recently, most experts believed everyone should be treated for their blood pressure if they hit 140/90. For those with diabetes or chronic kidney disease, the target number was 130/90. However, an increasing number of experts now believe 150/90 or lower is acceptable for most people age 60 or older. And for those with diabetes or kidney disease, a maximum of 140/90 is actually recommended. So this shift in recommended target blood pressure levels provides more flexibility in actually managing hypertension, potentially allowing some patients to avoid intensive treatment or medication side effects. See, the goal is to find the right balance between lowering risk and maintaining quality of life. The new higher blood pressure target numbers have been actually recommended by a panel of experts appointed by the National Heart, Lung and Blood Institute, as well as by numerous heart doctors. See, the experts agree that it's still a good idea to strive for the optimal blood pressure level of 120/80 to prevent, let's say, heart attacks or strokes. However, they argue that achieving this often requires high doses of multiple medications, which increases the risk of side effects. And some common side effects of blood pressure drugs can include a nagging cough, frequent urination, dizziness, erectile dysfunction, and potential increases in gene mutation effects. As one expert stated, no one likes to take medication that they don't need to take. The panel believes the new slightly higher target blood pressure level of 150/90 for most older adults or 140/90 for those with diabetes or kidney disease may provide a better balance between lowering cardiovascular risk and minimizing medication-related side effects. So if you do have high blood pressure, it's critical to make lifestyle changes before considering medication. That said, here are some proven strategies that I've helped numerous patients with. Going on a low-carb dietary approach is shown to reduce systolic blood pressure by 8 to 14 points. Getting regular high-intensity interval training, at least 25 minutes 3 times a week, reduces systolic blood pressure by 4 to 9 points. Losing weight, for every 11 pounds lost, systolic blood pressure declines by 2.5 to 10 points. Reducing white table salt and switching to Himalayan or Celtic sea salt reduces systolic blood pressure by 2 to 8 points. Using natural remedies by saturating with magnesium and adding nitrate or intake of nitric oxide vegetable rich with potassium have shown to drop both systolic and diastolic for good. See, millions of people take blood pressure medications, drugs known as ACE inhibitors, ARB, beta blockers, alpha blockers, calcium channel blockers, central agonists, and diuretics. And other than these mentioned drugs causing fatigue, breathing problems, heart palpitations, constipation, insomnia, joint pain, memory loss, and erectile dysfunction, to name a few, all these could be controlled with simple changes in lifestyle, diet, exercise, and natural remedies. But for today, I'm going to put all my focus towards supplementation. Number 1, magnesium is an essential mineral that builds strong bones, but also lower blood pressure and control all type of irregular heartbeats. My recommendation is between 300 to 1200 milligrams per day in separate doses using magnesium ionic chloride. Number 2, hawthorn tea is a herbal remedy, helps the heart function more efficiently, and contains a beneficial flavonoids which cause the blood vessels to relax. Drinking up to 3 cups a day using 1/4 teaspoon of hawthorn dried berries per cup. Number 3, nitrate or nitric oxide from beets and or potassium nitrates of an extraction of 25% or higher, or 250 to 300 grams of serving of beets or arugula will offer 500 milligrams of nitrate that converts to nitric oxide, which relaxes and dilates blood vessels. And studies have shown this can actually reduce systolic and diastolic blood pressure by 8 to 15 points after 2 weeks of intake. And other items that actually work great as well are pomegranate juice, tart cherry juice, walnuts, and kefir. Number 4, more additional supplements would be added, such as coenzyme Q10 300 to 600 milligrams, omega-3 6000 milligrams, vitamin D3 10,000 IU, the amino acid acetyl L-carnitine 3000 milligrams, and taurine up to 9,000 milligrams will keep your blood pressure under control. Now, going back to my first point, which is magnesium, here are the levels that should be maintained after saturating correctly. Adults from 19 to 30 years old, 400 milligrams per day for men and 310 milligrams per day for women. Adults of 31 years old plus, 420 milligrams per day for men and 320 milligrams per day for women. But keep in mind, if you are an athlete, your maintenance levels could be doubled. In addition, here are a list of common drugs that raise heart risks: painkillers, heartburn, medications, cold and allergy remedies, mouthwash. I consider these being man-made killers. Also, here are 5 fatty foods that are healthy for you, such as wild fish, sprouted nuts, raw dairy, animal fats, and coconut oil. And my last point, nitric oxide, specifically if you have a stent or a genetic mutation. Nitric oxide is actually a gas that plays a crucial role in our bodies, as it can pass through cell membranes and regulate various cellular functions. See, back in 1980, there was a Nobel Prize that was awarded for 3 researchers that claimed in the presence of nitric oxide, no heart attack should actually occur. Now, in the body, nitric oxide is actually produced from an amino acid called L-arginine. When L-arginine circulates in the blood, it actually triggers a reaction where one of its atoms becomes with an oxygen molecule, forming nitric oxide and forming an amino acid called citrulline. See, the problems with both of these amino acids, they activate induced nitric oxide, where if overconsumed or do not have the proper antioxidant in your body, will actually cause harm to your endothelial nitric oxide. And that's why I've always recommended, if you are interested in using a nitric oxide supplement, to use the current one I've been utilizing for the past 10 years, as it's derived from 25% patent extraction of beets and potassium nitrate, where it actually activates up to 8 hours instead of actually utilizing citrulline or arginine with multiple antioxidants to only activate for 6 seconds. And the amazing thing about nitric oxide it does not only help with ENOS, but it also improves the immune system, sexual function, and memory. And research has shown the following. So number one, in the cardiovascular system, nitric oxide helps the nervous system fight infections, regulates blood pressure, control blood flow to various organs, and prevent blood clots. Number two, in the immune system, white blood cells produce nitric oxide to attack and destroy bacteria and viruses. Number three, now in the brain, nitric oxide is formed in nerve cells and activates neurons involved in many functions, including behavior and the digestive system. Number four, nitric oxide is also thought to play a role in common long-term memories and our ability to identify different smells. And a recent analysis of 11 separate high-quality studies published in the American Heart Journal concluded that taking a nitrate supplement orally can influence both the top systolic and the bottom diastolic numbers of blood pressure readings, suggesting that nitrate supports overall heart and immune system function. Now, as for the inherited gene variants, there are 174 gene variants that are associated with heart attacks, strokes, and other cardiovascular conditions. Number one, 9p21, often called the heart attack gene. Number two, variants of the apolipoprotein E gene. Number three, defects of the K1F6 gene. And number four, mutations of the interleukin-1 genes. So if you have any of these genes, I would highly recommend for the following for the rest of your life to be actually consumed: nitric oxide, D-ribose, coenzyme Q10, magnesium ionic chloride, and acetyl L-carnitine.